So the most common causes of abdominal pain are something that we call functional. So where the body is functioning to do something and that presents with a pain. A classic example of this is constipation or slow transit of movement through the bowels. Is it related to food is a possible differential to many causes of tummy pain. I get commonly asked, could this be celiac disease, doctor? Well, yes, it could be. One of the simple tests that we do to be sure that we aren't misdiagnosing celiac disease, for example, as functional pain is doing a simple blood test. If it's related to food, what we would ask you to do is keep a food diary. So simply write down what your child eats and if there's any pain that follows, the time of day this happens, and also does this occur overnight. That helps us work towards investigating, is the cause of the tummy pain related to what you eat? So tummy pain can present for many reasons, and tummy pain on children that comes from the center of the tummy sometimes can be related to other medical conditions anywhere else in the body, so not always associated with the tummy. And pain sometimes doesn't always mean it's going to be a bad diagnosis. And in fact, having no pain sometimes can be a sign of a red flag sign in medicine that we need to identify early. So if your child does have tummy pain, there are a lot of different causes for that, and it's my job to investigate the cause. So treatment is based on identifying the cause and treating that. However, at home, just giving simple pain relief, such as paracetamol, for example, is helpful, because tummy pain that doesn't respond to pain relief might be the sign of something else going on that we need to investigate further. So with respect to tummy pain or any medical condition, if you're concerned enough about your child, please seek medical advice. That's what we're there for, and we are very happy to help. Specific to tummy pain, I would be very concerned if the tummy pain wasn't just in the middle of the belly and it was outside, so the top of the tummy or the bottom of the tummy, around to the sides or even the back, because that can be the sign of something else going on within the tummy. You may have heard of such conditions that are considered surgical emergencies, for example. These would be conditions such as appendicitis. So you might have abdominal pain with temperatures. So you don't want to be ignoring that. So that would be an example of getting medical assessment. Another one, for example, is having tummy pain with vomiting. That's another symptom that I wouldn't ignore. It may be a simple diagnosis, but there could be something else underlying, and that's our job to figure that out for you. So after we take a focused medical history and examine your child, most likely we will have an idea of what is going on. However, we might need the help of some investigations to direct treatment or make sure that we're not missing something else. So first thing to say is we may not need to do any investigations at all. That is appropriate. However, if we do need to, these would be things like blood tests, urine samples, and sometimes some imaging that could include the likes of ultrasounds or x-rays. And in more severe cases where we have to do more invasive investigations, we may need to consider putting a scope down to have a look.